Hello and welcome to Food, Allergy, and Your Kiddo. I'm your host, Dr. Alice Hoyt. Hey, Pam.
Hey, Dr. Hoyt.
Super excited about today's All You Need to Know segment, right? So all you need to know about epinephrine in under 10 minutes.
Let's do it.
Start the clock.
Here we go. I just started it. 10 minutes on the clock. All right. So why is the treatment for anaphylaxis epinephrine?
Excellent question. The treatment for anaphylaxis is epinephrine because epinephrine actually stops the allergic reaction. So what we used to say was, okay, if you're having a severe allergic reaction, anaphylaxis, go ahead and give an antihistamine, give Benadryl, and wait and see if symptoms get better before giving epinephrine. We know based on evidence-based medicine, research, studies, science, we know that prompt administration of epinephrine is what gives us better outcomes than the whole wait and see. Why is that? That is because epinephrine binds to the allergy cells and shuts down the reaction. So first of all, that's important. We call that mast cell stabilization. Mast cells are the cells that are the divas of these allergic reactions. They're causing all the drama. They're spewing out these cannonballs, like I call them, that just cause all the havoc. One of those cannonballs is like histamine, contains histamine. Histamine is absolutely an important chemical when it comes to anaphylaxis, but it's only one of them. Epinephrine can counteract histamine's effects. Also, epinephrine is going to counteract, these are important, vasodilators and bronchoconstrictors. So vasodilators are making the blood vessels open up. That's a huge bummer when it comes to your blood pressure. Blood pressure is dropping because your blood vessels are opening because your allergy cells are spewing out vasodilators. That epinephrine is going to combat that reaction and cause those blood vessels to tighten up so that your blood pressure can come back to normal. Why blood pressure is important? Because it is perfusing our brain. So in anaphylaxis, blood vessels open up, blood pressure drops, heart rate is increasing to try to pump that blood to the brain to keep oxygen flowing to the brain. Epinephrine helps close those blood vessels back up. With lungs, bronchoconstrictors, it's different. So epinephrine is going to counteract bronchoconstriction. Bronchoconstriction is when the airways tighten up. So vasodilation, blood vessels open, bronchoconstriction, airways shut down, clamp down.
Okay.
Epinephrine, I know. Epinephrine opens up the airways.
No, this is great. Yes. Science class.
Science class. Yes, science class. So that is what epinephrine does. Epinephrine is already being made by your adrenal glands. It's just in some cases, for whatever reason, when someone's having a severe allergic reaction, they might not make enough epinephrine. And so that's why we need to give epinephrine from an auto-injector. Because it's the right dose, it's the right concentration, and you're giving it the right route, which is through the muscle. Outer thigh, not the arm, outer thigh. And it should start to work within a few minutes. A lot of people notice a difference in like 90 seconds, but it's definitely starting to work in a few minutes. If you need a second dose, meaning you're still vomiting, you're still having trouble breathing, then you're giving a second dose at 5 minutes. But that's why epinephrine is the treatment for anaphylaxis, is because not only does it shut down the allergy cells to stop them from causing the reaction, but it can counteract more than what just the histamine is doing. That was pretty good.
That was pretty good.
Regarding, sorry, not to toot my own horn. I'm just talking about the time. Like I'm looking at the time and I'm like, ooh, okay.
Yeah.
Okay. So all you need to know about epinephrine in under 10 minutes. But I feel like there's more to know about epinephrine. What are the questions we usually get about epi? Ooh, I know. So yes, there is.
When to use
it. You use it whenever anaphylaxis is occurring, and so you can recognize anaphylaxis if two systems are involved. You ingest your allergen, or you're stung by your allergen, right? If you're allergic to bees, whatnot. If you start having skin symptoms and GI symptoms, or respiratory symptoms and skin symptoms, or
Right.
respiratory symptoms and GI symptoms. Another definition of anaphylaxis, and this is more common in like the ICU setting when we accidentally give somebody a drug that they're allergic to, or we didn't know they were allergic to the drug.
Right.
They're exposed to the allergen, they get the drug, whatever, and then they have just like a sudden drop in blood pressure. So those are times that you're recognizing anaphylaxis and you're treating it with epinephrine. And I'll also speak to, well, I've treated it with Benadryl before and I've been fine. Well, that is because that reaction was going to resolve anyway. And
Right.
yes, the Benadryl may have helped some of like the hives, may have helped some of the swelling, but those are not the things that are really the life-threatening symptoms or signs of anaphylaxis. And so in that case, thank goodness your body was making enough epinephrine to settle down that reaction itself.
Exactly. And to speak to that, what we do tell our patients is to follow the very specific action plan that you write for them.
Yes, yes. So on that note, what COVID taught us, and what we kind of already knew as allergists anyway, is that regarding using epinephrine, most allergic reactions respond to one dose of epinephrine. So then why were we like inducing torture on our patients by saying, you have to go to the emergency room? So now you should ask your allergist, is my action plan still one dose of epi? I'm calling 911 to go via EMS to the emergency room. Because in some cases, that might not be your action plan. In some cases, that absolutely still is your action plan. But don't be surprised if your allergist is having a conversation with you about your kiddo saying, based on X, Y, and Z, I think that it's okay if you and your husband feel comfortable, or you and your wife feel comfortable observing your child after one dose of epinephrine, making sure they respond to it, they're feeling better, that it's okay to stay home and actively observe. You're not doing nothing, you're actively observing.
Right.
Instead of feeling forced to go to the emergency room where you'll be observed and hang out for a while. In the time of COVID, being exposed to stuff. And that's where we were like, well, if you look at the science, it's highly unlikely for someone to need a second dose. But if they do need a second dose, then you're absolutely going to the emergency room. I think the number right now is about 7% of episodes of anaphylaxis require a second dose of epinephrine. So, it definitely happens. It definitely happens. But I will say that in many cases, when anaphylaxis is recognized promptly, and anaphylaxis in epinephrine is administered promptly, then it works promptly and you're feeling better promptly.
Yeah.
So that's another thing. It's like, nobody likes a shot. Nobody likes a shot. But that epinephrine is going to stop that reaction. So oh, there's my timer.
Sorry.
So it's going to help that child or that person feel a lot better, a lot quicker than if you give Benadryl and just kind of wait and see. Also, Benadryl, it crosses the blood-brain barrier. I tell my patients to throw it away.
Yeah.
I hope Benadryl doesn't try to sue me, but I don't like Benadryl. Freedom of speech, right? I don't like Benadryl. It crosses the blood-brain barrier. It prevents you from getting good sleep. That's why if you do take Benadryl to try to sleep, you wake up, you're still like groggy. It's because your brain has not been able to get into good sleep. So it really has zero role in anaphylaxis.
Yeah, and I was going to say, for kiddos, people tend to be scared of epinephrine injectors sometimes, but you guys, it's literally like 3 to 5 seconds, and it might hurt for a second. But it's saving lives. So
yeah, it depends on your auto injector. So to be clear, if you have an AuviQ currently, it's 2 seconds, and it'll talk you through how long to hold it. If you have an epinephrine, like an EpiPen, then it's 3 seconds. And if you have a Amneal, I don't even want to say generic, because there is a authorized generic
Adrenoclick, maybe.
But it's not Adrenoclick anymore. It's a generic of Adrenoclick, which is Amneal. At least it is at this time.
Talk to your allergist.
But really, hold it for what it says, but just know that it is going in immediately. It's not trickling in over 2 seconds or 3 seconds or 10 seconds or whatever it says. You just don't want to inject and then suddenly retract it. Put the device where you want it to, in the outer thigh, and then apply pressure. You also don't need to stab and be all dramatic. That ain't how.
No, it's not. Well, Dr. Hoyt, we did it again. Good job.
Yay! Under 10 minutes. Okay, and the biggest thing that you have to know about epinephrine is when to use it for your child. So talk with your allergist about when to use it in you or your child.
Thank you.
You're welcome. Thanks so much for tuning in. Remember, I'm an allergist, but I'm not your allergist. So talk with your allergist about what you learned today. Like, subscribe, share this with your friends, and go to foodallergyandyourkiddo.com where you can join our newsletter. God bless you, and God bless your family.